Ça va, je t'ai pas ce soir. C'était juste pour dire bonjour.
Ça va. Et toi?
Oui, ça va.
Ok. Non, parce que j'ai...
Okay, it's 5:30, so I will start. My warmest welcome to everyone joining us on the webinar today. We have more than 300 registered from over 70 countries. This webinar is a restricted session. We exclude representatives from tobacco industry and those representing its interests from attending this webinar. My name is Nantawan Wichitwatakan, Chair of the WHO FCTC Knowledge Hub for Article 5.3, and I will be your moderator for today. Today's webinar on countering tobacco industry interference in the time of COVID-19 is co-presented by the WHO FCTC Secretariat Knowledge Hub for Article 5.3, whose mandate focuses on supporting parties in the implementation of the WHO obligations on protecting against the tobacco industry interference, and the Global Tobacco Industry Watchdog, STOP, a project funded by Bloomberg Foundation, whose work centers on exposing tobacco industry interference, and which incidentally launched a campaign on tobacco accountability today. Before we start, on behalf of all of us, I wish to give a special tribute to the frontline workers everywhere who have been working tirelessly and risking their own lives and safety to combat the COVID-19 pandemic. We salute you. As of June 7th, according to WHO, globally, there are now nearly 6.8 million COVID-19 cases and almost 400,000 deaths. There is growing evidence that smoking is associated with increased severity of disease and death in hospitalized COVID-19 patients, and vaping may also play a role. This adds to the devastating health and economic impact of the COVID-19 pandemic crisis. In the midst of all this, and while many businesses suffer financial loss, tobacco industry continues to reap profits from aggressively marketing and selling their toxic and addictive products that contributes to further exacerbating the pandemic crisis. Tobacco industry is exploiting this global health crisis to continue its tactics in undermining public policies. Countries cannot fall prey to tobacco industry tactics of negating the science and shifting the public attention toward the use of vaping and heated tobacco products, and its tactics to represent itself as a legitimate partner in alleviating the economic burden in this crisis through their CSR. At this juncture, the health sector is expected to continue issuing guidelines for new safety measures as part of the new normal, while economies are seeking ways to recover. This webinar aims to empower country advocates to take action by providing them with the tools, knowledge, and recommendations to assist their countries in strengthening the implementation of the WHO FCTC as part of COVID-19 responses. Before we kick off, I would like to make a few administrative announcements. We are streaming live on Facebook. We value your participation in this webinar and encourage you to respond to our polls throughout the entire session. You may also post your question at any time during the webinar by using the Q&A icon found on the bottom of your screen. The Q&A session will take place after all our speakers have finished their presentations. This Q&A session will be private and not live streamed. I wish to introduce Ms. Tina Hippolito, our webinar admin, who may intervene if there are technical issues. Without further ado, I now wish to introduce and give the floor to our esteemed keynote speaker and global control champion, Dr. Adriana Blanco Macrizo. Dr. Blanco Macrizo is currently the head of the WHO FCTC Convention Secretariat. Before joining the Convention Secretariat, Dr. Maquizo worked as Chief of Risk Factors and Nutrition Unit in the Department of Non-Communicable Diseases and Mental Health at the Pan American Health Organization. She actively participated in tobacco control activities in her own country, Uruguay, which contributed to Uruguay becoming the first smoke-free country in the region of the Americas. She is a medical doctor and with a master's degree in policies to prevent addictions in children and adolescents from the Latin American Center of Human Economy. We are pleased to welcome Dr. Adriana Blanco Maquizo. You have the floor. We cannot hear you, Dr. Blanco.
Je devrais me reconvertir en femme de ménage à Divonne, moi, tu sais, en petit string, tu sais, pour faire le ménage des petites.
Dr. Blanco, you muted your microphone.
Yeah, no.
Now we can hear you.
Can you hear me? Can you hear me now?
Yes.
Oh,
please.
okay, perfect. Thank you very much. Well, thank you for the invitation to open this this meeting. Really, we are living in an unprecedented situation, as we have heard so many times, and many of us didn't think that we are going to be faced with this kind of situation in our lifetime. But well, this is what happened, and we need to try to keep on pushing for not allowing this pandemic to undermine so much work that we have been doing in tobacco control before. If you can put the next slide, please. Well, we all know how important is health for development, for economy, or for all aspects of human life. But really, this pandemic has underlined this situation as an extreme that really, I think no one now ever will doubt about the multi-component effects that health can have in the rest of the aspect of our individual life and of the economies of the countries and of the world as a whole. That was recognized already in the SDGs when we have one of the means of implementation of the goal 3 in well-being and health for everyone. That is the goal 3.8. That is exactly the implementation of the WHO FCTC. So it's very important that during this pandemic, while health professionals and scientists are working around the clock to trying to find either vaccines or treatment for this pandemic, we as part of the health community and specifically as part of the tobacco control community, we need to help the work to keep a healthier environment and to help people to choose health behaviors in order to get a better outcome if they get disease. Next one, please. So in the last COP, the parties to the WHO FCTC has approved a global strategy to accelerate tobacco control. And I want to underline the word accelerate. We all recognize that we are doing a lot in tobacco control, but unfortunately it's not enough. If countries do not accelerate the implementation of the WHO FCTC, we are not going to meet the goals that are both in the NCD Global Action Plan and in the SDGs of decreasing the preventable mortality due to NCDs in the world. We know that tobacco use and exposure to secondhand smoke is one of the most impacting risk factors in order to decrease mortality. So really, we need to accelerate the implementation of the FCTC. And that is why this pandemic can be so dangerous, because that could mean that we, instead of accelerating, we can be slowing down the implementation. So that we cannot let that to happen. And we know that one of the pillars of the strategy is specifically that, to protect the integrity of what we already achieved in the FCTC, and in general, protect the integrity of the tobacco control movement from the tobacco industry that is trying, as always, to undermine our achievement. Next one, please. We know that this pandemic of communicable diseases has been intertwined with the non-communicable diseases, because we know that the people with pre-existing conditions, especially non-communicable diseases, has the ones who really has the worst outcomes in this pandemic. And when we look at the number of people that tobacco has killed every year in the world, we really see that this can be called a slow pandemic, but it has exactly the same burden to the economy, to the health, and to the health system that any pandemic. The only thing is that we don't have all the cases together as we are seeing in this, with this overwhelm of the health systems all around the globe. But it still is a pandemic. It still is killing an incredible, enormous amount of people. And this pandemic has been here before the COVID-19 pandemic, is here together with the COVID-19 pandemic, and is going to be here after the COVID-19 pandemic if we don't act now. So it's very important that we are conscious that this pandemic, epidemic we call it before, but I think pandemic is a better way of characterizing it, has been killing people and is going to be killing people before and after this current pandemic. And we know that there is one responsible, that is the industry that really produce these consumption goods that we know kills up to half of their consumers if they are used as their manufacturers intended to. And you have seen, if you have seen in my first statement as a head of the convention secretariat, that I didn't put a judgment on the government that in this unprecedented situation, extreme situation, has had this horrible dilemma of need to choose between the health or the means that they need to provide to the health workers and to their populations, and receiving help from an industry that is killing these people anyway. So I am not going to talk about the countries, but I'm going to talk about the industry, because we know it's not the first time that the tobacco industry is using this crisis, these catastrophic moments in the world, to lend a hand to the countries in order to theoretically help to protect life. As Philip Morris says in now that it was awarded as one of the most sustainable industry. We know if they are sustainable because since they kill more people, there is less people polluting or what, but I don't know, they have an award. But they say that they are very concerned about communities. The same communities, they kill the people when they use these things. So there is no way that we can have anything good to say of this philanthropic help, because it's not philanthropic, it's just a PR way of presenting themselves better to the governments. And we have the FCTC that provides parties with some arguments in order to counteract those things. And really the Article 5.3 and the guidelines for the implementation of these articles are very clear in this. They're guiding principles from the first one that says that this is irreconcilable conflict of interest between the interest of the tobacco industry and the interest of the public health community. I think that that makes very clear that it's no way that we can advance in the same direction. And I'm not going to repeat to yourself all the recommendations that the guidelines for Article 5.3 has, because we know it very well. Some of them are there. Just to remember that sometimes, and many times, it's not the tobacco industry, but other front groups or other groups that try to work to further their interests. And we need to be very clearly with whom we are talking as a country or as an organization, because usually the tobacco industry don't go by itself to pretend to present their things. Next one. We also have beyond the article, next one please, beyond the article 5.3, we have also, one back please, we have also the guidelines for the implementation of Article 13, where we have also specifically addressed the socially responsible causes that they recognize is just a way of sponsorship, and the publicity of this sponsorship, because sometimes they say, okay, we say what we are doing, but still that is just another way of promotion and of marketing. So from the 5.3 of Article 13, both of them give us the tools in order to counteract this interaction of the tobacco industry. Next one, please. At the Secretariat, we are working with this collaborating center that to the, Knowledge Hub. This is the use of working so many years for WHO before. Is the Knowledge Hub that we know that is working with us today. It is the Knowledge Hub for the implementation of Article 5.3, and with them, we are working in developing a communication plan in order to counteract the tobacco tactics, in order to make very clear to people that there is no good intentions when the tobacco industry is trying to help. There is nothing, because if they have truly good intention, they will just end producing their product. That will be the best good intention that they can present to a country. We are also working in an e-learning tool to support the parties, to support the implementation of Article 5.3. And of course, the Knowledge Hub itself is available to all parties that need some help in order to how to implement these measures, in order to contact them through us or directly to them, in order to find some help in how to work in this area. Next one. So it's amazing that even in these difficult times, tobacco control is still advancing. Not only we have Kenya as the 59th party to the protocol, that we have a new party to the WHO FCTC, what seems so difficult at this moment, because Andorra has ratified the FCTC last month, and that was really for me the way I saw another ratification for the convention. I said, this is my gift of getting the position, having one more party now that I'm the head of the convention secretariat. We have countries like the Dutch that is ending the sale of tobacco in supermarkets and in gas stations. We have Ethiopia that passed a bill on increasing taxes. And we have the whole European Union that has banned flavored cigarettes. So countries are not leaving that the pandemic is stopping them. They are still working and they're still passing different measures in order to counteract the tobacco pandemic. Next one, please. And I need to say, so if I'm finishing my remark, that really, I think that, again, I'm saying we are living through a pandemic. We need to remember that tobacco can be assimilated to a slow pandemic, that both pandemics goes together, and this may not be the last pandemic either. So it will be good for the future generation, not only if we can end tobacco consumption, but also if we can, in the meanwhile, improve the possibilities of, if there is another pandemic hitting us, that the possibility of the people will be better. The FCTC implementation should need embedded in the recovery efforts, because at the same time, as I said at the beginning, that the health professionals are looking for solutions to this pandemic, we need to help individuals to be more healthy through tobacco cessations, but also in general, the populations enjoy a healthier environment, like for example, a smoke-free environment, and also with the other measures that can decrease consumption, and especially talking about increasing taxes that can give money that it will be so needed for the health services in this moment, and also completing bans on advertising, promotion, and sponsorship in order to close the link and avoid these corporate social responsibility campaigns of the tobacco industry. So thank you very much for listening to me, and we are here in the Secretariat ready to help any party that will like our support to keep on implementing the Tobacco Convention in these times. Thank you.
Thank you, Dr. Adriana Blanco-Macuza, for your guidance and informative message. I now wish to invite our next two speakers who will address the tobacco industry tactics during the pandemic, Professor Anna Gilmore and Dr. Mario. Professor Anna Gilmore is a professor of public health and founding directors of the Tobacco Control Research Group at the University of Bath, UK. Her work in corporate influences on public policy and tobacco has contributed greatly to the tobacco control effort at the national, European, and the global level. Among her notable accomplishments include countless publications, member of numerous international, national, and WHO expert groups and committees. Her contribution to the tobacco control effort is recognized through the Public Health Advocacy Institute Award and the WHO World No Tobacco Day. While Dr. Maria Sunta is a 203 Luther Terry Awardee for outstanding leadership in tobacco control. She is responsible for global research and advocacy at GTTC, or the Global Center for Tobacco Control, and is also the senior policy advisor for CEPCA. She has more than 20 years of experience in international tobacco control advocacy, representing low and middle income countries in many platforms to counter and debunk tobacco industry tactics. She is the principal author of the Tobacco Industry Interference Index, which is being adopted widely to gauge the tobacco industry interference in many countries. And now you have the floor.
Thank you, Toy. So it's a pleasure to be here and share this platform with my good friend, Maria Sunta. Can we move to the next slide, please? So in 5 minutes, we are really only going to scratch the surface of the tobacco industry's response to COVID-19. So throughout the slides, I've tried to put web links to various resources that we and others have developed. And I just wanted to flag that actually on Tobacco Tactics, we have a new COVID-19 page. And on the STOP website, there's also a resource center for COVID-19. So there's more information, linked to this presentation that you can access. Next slide. So let's start with what the tobacco industry is scared about in relation to COVID-19. Philip Morris's recent annual general meeting made that clear, and these slides are taken from its presentation that day. The short answer is Philip Morris is scared about the very thing we need to happen in order to reduce the risks from COVID-19. That is smokers giving up or reducing their consumption. And its slides show that it's particularly concerned about consumption falling in low middle income countries. Of course, this comes on top of a pre-existing decline that we're seeing now in global cigarette consumption. It's worried about smokers down trading to cheaper products and the loss of their duty-free sales being predominantly premium brands. So really it's fearful about a decline in profits. And again, this will be made worse by the inevitable economic recession that we're seeing and which will follow. And it's worried, as the bottom slide makes clear, about not being able to acquire new users for its flagship heated tobacco product, IQOS. I mean, it estimates that user acquisition, as it refers to, may be up to 50% lower. And ultimately, it's worried that factory closures will lead to stock shortages. It's worried about not having enough cigarettes to sell. Next slide. So longer term, there are also other risks to the tobacco industry from COVID-19. Reputation damage. As we've heard already, COVID-19 will bring to the forefront the appalling health and economic impacts of smoking. as we've already heard, it's increasingly clear that smokers are not only at greater risk of severe disease, but also of death from coronavirus. And that really is damaging yet again to the industry's reputation, to add to the long, long list of diseases that tobacco causes yet another negative impact. And then is the regulatory threat. While governments might be distracted now, they will ultimately need to fund their recovery from COVID-19. And in the mix of options, taxing tobacco will inevitably seem very attractive. But for the tobacco industry, therefore, these two risks are particularly problematic. It's going to be harder for it to fight tax increases, as it usually does, if its reputation and ability to access governments is damaged. So next slide. So these threats really explain the response that we're seeing from the tobacco industry. And we've summarized here 4 key responses that we're seeing so far. So firstly, here's this one, please. The industry, well, I'll keep talking. We'll try and keep the slide on that one. So the industry is really having to engage in innovative marketing to try and prevent reductions in its sales volume. It's having to engage in CSR to minimize the reputational harm. And it's interfering with government's COVID policy-specific responses in order to minimize reductions in tobacco sales and to prevent quitting and ensure that cigarettes continue to be available. And finally, it's also harnessing COVID-19 as an opportunity to interfere with tobacco control policies more broadly. So next slide now. Let's look at each of these in turn then. So first of all, the product and brand marketing. What we're seeing, particularly via social media, is that the industry is taking advantage of messaging around the pandemic and focusing in particular on promoting its next generation products. Can we stay on this slide maybe? So I'm sorry, one of the pictures there has not come through. But what it showed was PMI's online marketing of IQOS. So Philip Morris is referring to COVID-19 on social media to promote special offers and home delivery of IQOS in at least 18 countries. And this has raised concern amongst some that it's going to be impossible to check age of sale verification on delivery. And BAT in turn, if you look to the right-hand side of the slide, is offering its heated tobacco product Glow. And it's offering this with special discounts and prizes and even branded face masks and hand sanitizers to go with the purchase. And here you see a picture of a branded face mask, which BAT has provided to social influencers in Kazakhstan, for example, even though obviously it's going to be impossible to use these whilst using Glow. But it's also adapting its previous marketing slogan, which was #TodayIWill, to take advantage of COVID-19 and changed it to #TodayIWillStayHome. So there's a key concern here, I think in particular around the marketing of heated tobacco products. First of all, because this marketing will undermine quit efforts. And so far the evidence is suggesting that the pandemic is stimulating quitting. And secondly, because there is no evidence that heated tobacco products help quitting or that they reduce health harm compared with cigarettes. So there is some evidence that heated tobacco might reduce admissions of and exposure to harmful compounds. But actually, there's no evidence that this translates to reduced harm in the body. And independent analyses of PMI's own data suggest that IQOS may be as harmful as smoking. And in fact, despite all its public claims, Philip Morris actually in its submission to the FDA notes, and I quote here, "It has not been demonstrated that switching to the IQOS system reduces the risk of developing tobacco-related diseases compared with smoking cigarettes." So that's even in Philip Morris's own words. Next slide, please. So predictably, we've seen a spike in tobacco industry corporate social responsibility. And as these two examples from the Philippines and Greece illustrate, tobacco industry CSR has particularly targeted health ministries and hospitals. Next slide. So those are just two of many examples. I've listed some others here. And on the right, there's an image again taken from Philip Morris's AGM a few weeks ago. And that enables us to see where the tobacco industry's motivations lie. So it highlights that Philip Morris is focusing on hospitals and at-risk populations. We've already heard, of course, that that includes smokers and those with smoking-related diseases. And this, of course, is typical of tobacco industry CSR and consistent with clear evidence from the academic literature that CSR is not genuine philanthropy, but it is instead used by the tobacco industry to distract from the harms that it causes and to facilitate access to policymakers and to increase public trust in the industry. So in short, the evidence is clear that CSR is an integral part of tobacco industry political activity. So at this point, I'd like to hand over to Mary.
Next slide, please. Thank you, Anna. Hello, everyone. I'd like to begin by acknowledging a very important statement that WHO put out in April, pointing out how the tobacco lobby is applying pressure on governments during the COVID-19 to have tobacco retailers listed as essential and even offered to deliver cigarettes and other tobacco products to people in quarantine. This is really an important statement because it highlights the fact that there is a problem with the industry applying pressure and that it's global in nature. Next, please. So for the next few slides, I'm going to look at, provide some examples of how the tobacco industry has been engaging in interference activities, and particularly protesting and challenging some of the important efforts that governments have made across the globe. And I will begin in South Africa. In March this year, with regards to the pandemic, the South African government, particularly Ministry of Health, issued a directive to ban the sale of cigarettes during the 21-day lockdown. Initially, BAT South Africa appealed, to remove this ban, and later on in April, the Fair Trade Independent Tobacco Association petitioned the court to reauthorize the sale of tobacco products. And in May, BAT South Africa then filed a legal challenge against the ban. So what happens is the government, already has its hands full dealing with the pandemic, and now it has got to face a court challenge from two sources, and hence its limited resources are now being spread really thin in having to deal with something which the government feels is important to protect public health. Next, please. Similarly, there are other examples from other countries. In Brazil, PMI maintained that cigarette production, despite a decree from the government banning non-essential industrial manufacture. And similarly, in Russia and Argentina, there were media statements and appeals against the restrictions on cigarette production. So you can see the tobacco companies challenging governments, if not in the press, then it will be in the court. But I'm also pleased to announce that there are governments who have made similar decisions, but have stood by them irrespective of any negative publicity or pressure. For example, the Indian government issued a directive in April 15th, and similarly Botswana in April 7 banned import sales of tobacco products. Next, please. So we go to Bangladesh now to get a little view of how the tobacco industry would actually apply pressure indirectly, but working through another government department. And so in Bangladesh, the Ministry of Health had issued a directive to ban tobacco production, and immediately BAT and Japan Tobacco sent a letter to the Ministry of Industry evoking an old legislation called Essential Commodities Act of 1956, saying that cigarettes are listed as an essential item, and therefore the Ministry of Industry should intervene in the situation, which the Ministry of Industry did. And within a matter of days, the Ministry of Health had to rescind its decision. So this is a clear-cut example of when the industry is unable to directly influence, it'll actually work through another department and pit one department or play up one department against another. And the Ministries of Health have come under tremendous pressure in some cases. Next, please. We are still on the subject of policy interference. And so you looked at how the industry challenges government action, but it also keeps its factory open and production running. And in that way, it fails to protect its workers. And so in the case of Indonesia, we know that there have been worker deaths in a Philip Morris affiliated factory. We also know that in Nigeria and in Zimbabwe, tobacco workers have actually accused BAT of failing to allow for social distancing. So it is also protecting the rights of workers during the pandemic, which the government would then have sent out a directive. Next, please. And in this case, we also need to look at the broader aspects of, sorry, please go back to the previous slide. Okay, stop in this one. The broader aspect of how the industry influences policy. If you look at COVID as an opportunity, the industry uses COVID as an opportunity to block, amend, or even delay broad tobacco control measures. And in the case of Indonesia, for example, the tobacco industry managed to obtain 90 days delay in the payment of tobacco excise tax. In Europe, some of you would be familiar that the implementation of the ban on the sale of menthol cigarettes was to come into force in May. This was already evident, for several years. However, the industry still utilized the pandemic to request for a postponement of this legislation. So you can see the industry continuing to circumvent legislation while the government is busy dealing with the pandemic. Next, please. So we now make some recommendations as to how to deal with this type of industry interference, and there are 5 recommendations. First, the government should reject CSR donation from the tobacco companies and thereby implement Article 5.3 and Article 13. The media should not give publicity to tobacco companies' charity, which is actually a form of promotion, and this again is tackled in Article 13. Governments should utilize the COVID-19 pandemic to promote quitting of all forms of tobacco use, as found in Article 14. Governments should also not grant any rescue package to the tobacco industry because their products are not essential products. And this again is addressed in Article 5.3, which talks about not giving any benefits to the tobacco industry. And the 5th recommendation would be to utilize tax increase as a tobacco control measure, implement Article 6 of the FCTC, because the tobacco companies have actually forecast their business for 2020 to be good. So they actually do not expect the business to go down. They have said so, several of them have said during their shareholders meeting, and hence, which means that if their business is going to be good, they should be taxed sufficiently. And with that, thank you very much, and I hand you back to the chair. And in the final slide, there are resources that you can refer to. The Exposed Tobacco website, Tobacco Tactics website, and also the GGTC website, where you will have more information. Thank you. Back to you, Toy.
Thank you very much, Anna and Mary. And thank you for pointing out that it's very important for governments to be vigilant during this pandemic on the various tactics that the tobacco industry will use. Rather than accepting tobacco industry handouts, governments should ensure tobacco companies pay their profit and excise duties in full. They need to implement Article 5.3, which is the best antidote for tobacco industry interference. I now wish to turn your attention to our poll, as I mentioned at the beginning. And the question is, has the tobacco industry taken advantage of the COVID-19 pandemic in your country? So while you are answering the poll, I wish to announce that I understand that some of you are experiencing some technical difficulties in seeing the slides in the large view. All you have to do is just double click on the slides and they will become larger. So please take a few seconds to answer the poll. And now we have the results. The results are that 88% of our respondents say yes, that the tobacco industry has taken advantage of the COVID-19 pandemic. And I think that's as expected. So thank you for your contribution, participation in this. So I wish now to introduce our next speaker, Professor Prakit Watisatokit. If I have to sum up Professor Prakit's achievements in tobacco control in a few words, which is very difficult, I would say a true champion of Thailand tobacco control and the WHO FCTC. He is on the tobacco industry watch list, which already says a lot about his contribution to the tobacco control globally. Although I have to really, tell you about his outstanding accomplishments. He was one of the principal drafters of Article 5.3 and 6 guidelines and instrumental in having them adopted at meetings. He's also was instrumental establishing the Thailand Health Promotion Foundation, funded by a 2% surcharge of tobacco and alcohol taxes. He has won numerous tobacco control awards, including the first Luther Terry Award for exemplary leadership in tobacco control in 2000. And he continues to inspire the tobacco control community. Dr. Brigitte, please, you have the floor.
Thank you, Chair, for the kind introduction. What I'm going to do in the next few minutes is to share Thailand's experience on tobacco control and the industry's movement in Thailand during this COVID-19 pandemic. Can you have the next slides? Yeah, the COVID-19 pandemic provide opportunity for the tobacco control in the country, particular country. So we use this opportunity to denormalize tobacco use, highlighting the connection between the increasing risk from smoking and the COVID-19. We also denormalize, expose the tobacco industry's movement in this period. And also, we also try to help the Ministry of Health to strengthen the implementation of tobacco control law and the WHO FCTC. Next slide. Now, we all know the theme of the tobacco control World No Tobacco Day this year is about the protecting youth from the industry marketing, and then empower youth and the social media influencer to fight about the tobacco industry targeting youth. But back in January, as late January, when we know about the COVID-19 pandemic starting, so we approached the WHO office in Bangkok, and then the Ministry of Health and the civil society, we decided to use the theme of the smoking and COVID rather than using the theme of the tobacco industry targeting youth, because we believe that if we go on with the same theme, the tobacco industry targeting youth during this atmosphere, it will not get the public attention. So we changed the topic to the smoking, increased risk of COVID infection and death. Okay. Next slide, please. We still use the WHO and the Secretariat's infographic translated into Thai, that the COVID is entry to the lung, and then the tobacco industry exacerbate this risk, and also that the smoker are more vulnerable to get COVID infection because of the action of smoking, the hand to mouth repeatedly, including the water pipe smoking, sharing water pipe smoking. Next slide, please. So we were very happy we have done that, because in the last week of April, we saw 5-6 TV station in Thailand airing this piece of news from the French study, so-called French study. And the headline was very scaring. The headline is that new hope, new opportunity, smoking and vaping, nicotine prevent COVID. So that kept us very busy for 2-3 weeks because of this piece of news. And then we are very fortunate that WHO had take action just 1 week after that, in early May to debunk the claim that smoking or nicotine can prevent COVID infection. Next. Now, in Thailand, we have two very active group lobbying for the e-cigarette and for the heated tobacco. The two gentlemen on the left, they were Thai. They set up a e-cigarette lobby group. And then one with the wearing the glass, he's on the board of the INNCO. It's called International Network on Nicotine Consumer Organization, which is funded by the Foundation for a Smoke-Free World. They very aggressive, very aggressive, keep attacking myself and other tobacco control advocates all the time. They want to, the government to lift the ban on the e-cigarette that Thailand had banned for the last 5 years. They now connected with the two parliamentarians in the opposition party and were successful in setting up a committee to consider the Thai law banning the e-cigarette. On the right is the CEO of Philip Morris Thailand. He is really loud talking about Thailand should allow the IQOS to be marketed in Thailand. Now I saw Professor Ann Gilmore's slide. It can be used for my tweet tonight that the reason is that because the IQOS is not meeting their projected market expansion. So they're very active during this period. There were 4 or 5 editorial in the different newspaper about the Thailand should lift the ban on e-cigarette and the heated tobacco product. Next. Next, please. Now, denormalize, no, the slide before. Philip Morris also proposed to donate about 5 million US for the government. What happens? The government is calling for the corporate industry to donate money for this COVID-19 crisis. So we heard that the Philip Morris is going to donate about 5 million US dollar, and we signal to the government that government cannot accept that money because we have a law, tobacco control law 2017 that prohibit sponsorship, prohibit donation, CSR activity by the tobacco industry or the front group. They can donate money to the so-called the industry supply chain, the farmer, for example. But then even then they cannot publicize the donation. So the government, fortunately, the government take our advice and do not take the money that Philip Morris is going to donate. And we counter and debunk the claim by the tobacco industry front group, especially the vaping group. The vaping group, though, they came out, they say this is a good time to switch from cigarette to vaping and heated tobacco, even though the e-cigarette and the heated tobacco are illegal in Thailand, but you can buy it in the black market and through the internet. So we are telling people to stop smoking. They'll say no. You just switch to vaping and then heated tobacco, and then so this needs to be coordinated work with the Ministry of Health and then the civil society. Okay, the Ministry of Health also take this opportunity to strengthen the smoke-free law implementation, and they have prosecuted many people who violate smoking in the public places because we were informing the public that the smoker are more likely if they're infected with the COVID-19 and they smoke in a public places, when they cough or when they sneeze, it could spread the infection to other in the public area. So all this work, we need quite substantial financial support. Next. So we are lucky that since year 2001, we have passed a law requiring the tobacco and alcohol industry to pay 2% extra tax when they pay the excise tax. So we use that money to fund health promotion, tobacco control, and alcohol control. So the annual budget that we get is about 135 million US dollar. Okay, so this is make us still can active carry on tobacco control activity that during this time. Next slide. So the lesson here is that we still have continued activity on the Ministry of Health to play a leading role, because now that we have our legislation mandate tobacco control committee at the provincial level, all 77 provinces, and then they need to coordinate the tobacco control at the provincial level, not just providing cessation treatment. And then we use this opportunity that we suggest that no smoking should be a new normal for healthy lifestyle. Okay. And then so far we were lucky. The government cut the budget of all ministry, every ministry by about 10%, but they did not touch the Thai health money because this is a separate law. It's not from the regular budget, it's from the extra taxes paid by the tobacco and alcohol industry. And enforce the tobacco control, particularly on 5.3, because as I say, we have banned the CSR activity or donation by the tobacco industry. And then we propose to the government that it's a whole of society approach is needed to denormalize the tobacco use and counter the tobacco industry. So that's the end of my presentation. Thank you. And give back to the chair.
Thank you very much, Dr. Burkitt. Thank you for providing examples of Thailand's pathway to promote the WHO FCTC in the era of what we now accept to be the new normal. So without further ado, we have the next poll. And the question is, do you agree that no smoking should be the new normal in your country? After reopening, the new norm should be the new normal after reopening the country. So your answers are quite valuable. And I wish to remind you that please submit your question to our speakers at your convenience. And the result is 99%. And thank you, that's a very good response. And I wish to introduce our next speaker, Mr. Mohammed Javed. He currently serves as monitoring unit expert at the Ministry of Law and Justice, the government of Pakistan. Among his accomplishments over the past 17 years, he was instrumental in developing national tobacco control policy framework, advancing the WHO FCTC in Pakistan, particularly Articles 11 and 13, as well as banning import of shisha and related substances. His notable contributions include developing SOPs for interacting with the tobacco industry in line with Article 5.3 guidelines, and drafted various legislation on tobacco control. Mr. Javed, now you have the floor.
Thank you, Chair, for inviting me and providing me a chance to speak on this very important occasion. Starting from the Pakistan figures, next slide, please. We have about 207 million population, from which about 62.7% are under 25. We have about total 24 million tobacco users, among them 15.6 million are smokers and about 9.6 millions are other tobacco users, which is chewing tobacco. Next slide, please. This was coincidence that the COVID-19 and tobacco industry interference started at the same time. Like our financial year starts from the July and ends in June. So usually the budget proposals, their approvals from different committees start from February. And from 26th February, there was first case of corona, COVID-19 in Pakistan. And since then, the COVID-19 crisis is increasing and also tobacco industry interference is increasing. Next slide, please. In March, that was March 25, our Prime Minister announced an economic relief package for the COVID-19 that was covering basically the social protection in response to the COVID-19. In fact, the tobacco industry front groups realized at that time that Pakistan government is in need of money. They are looking after different sources for revenues. So they jumped in at that time. Next slide, please. If you see that they had an aggressive campaign by the tobacco industry front groups, that they were saying that government can earn or can get 44 billion rupees by countering the illicit trade issues. In fact, they raised the tobacco illicit trade issue, and meanwhile they want to get benefit. Like in May or June, government was preparing the budget, and it will be approved in June. So they were trying to influence by these tactics, like they were trying to influence the federal excise duty increase. Usually in every budget that is increased in Pakistan, they were trying to influence that, and meanwhile they were trying to divert the attention of the issue of illicit trade, and they were giving avenues. They correlated these figures with like the livelihoods and something other like that. Like they told that now this amount of money can be utilized to feed 9 million people 3 times a day. So they misinterpreted the figure and correlated these figures with like that. Next slide, please. And this was not only the print media campaign, it was an electronic media campaign, and meanwhile it was a social media campaign. So we have seen the hashtag Awaaz Uthao Mulk Bachao. This means raise your voice and save your country. 44 billion for Pakistan. Like they were telling the government that you can save the 44 billion by countering the, taking action on the illicit trade of issues. When we saw this campaign, this was targeted to the above 25 years of age people. Next slide, please. At the same time, the tobacco control activists came in the field and they encountered that campaign, and there was big print media ads and also campaign on the social media and electronic media sometimes, that if you put ₹10 on each pack, and you can earn about 37 billion a year, and this money can be used to combat the COVID-19 crisis. That was an aggressive campaign, and that was exposing the tobacco industry tactics and countering for their misleading messages. Next slide, please. And at the same time, that what we were planning at, we were conducting a survey that was a stop survey on illicit trade in Pakistan. This was started in September 2019 because we were foreseeing at that time that tobacco industry will play with the illicit trade issues figures. So these results were ready in March. So immediately we announced that survey, and we announced the findings of that survey in print, electronic, and social media to counter their tobacco industry tactics regarding trade issues. And this survey was conducted by the University of York, Ministry of National Health Services, Tobacco Control Cell, and other partners. And thanks to Dr. Zia for sharing me in the findings of that survey also. That was saying that the illicit trade in Pakistan is only 16.9%. So the tobacco industry is presenting exaggerated figures. Next slide, please. At that time, there was also the campaign in the media by the tobacco control activists that tobacco industry is portraying the deceptive tactics and deceptive message regarding illicit trades, and there was a very healthy debate in the media, and media was covering all these figures, and they were the figures were reaching to the policymakers who were involved in the formation of budgets. Next slide, please. And that time we also started portraying that tobacco industry is playing with these figures. And also one thing highlighted by the tobacco control groups and the tobacco control cell of the ministry, that there was a raid by the custom authorities, Federal Board of Revenue authorities, in which about 60 million sticks were recovered from an abandoned factory that was owned by a famous tobacco group. So the tobacco control activists were trying to portray that the tobacco industry and their front groups are itself involved in the illicit trade issues. This was the healthy debate in the print and electronic media. Next slide. Also with that, the tobacco control activists, also the tobacco control cell, they have searched some other avenues for collection of revenues that was health levy on cigarette packs and sugary drinks. So at that time, the tobacco control cell of the ministry and other ministries and some tobacco control activists, they have also demanded that there should be health levy imposed on cigarettes and sugary drinks for the win-win situation to reduce the prevalence of these, and also to get about 50 billion rupees from these health levy. In fact, it was started in last year. Next slide, please. And that was very strong proposal, and the legislation was drafted also on it. And in that, we had calculated at that time that we have 3 billion packs that those are being sold in Pakistan. These are legal packs, and we can get about 30 billion from these, and also from the carbonated drinks at the first stage, and then whole sugary drinks at the second stage, we can get 12, and then about 20 billion or so, we can get 50 billion. The legislation was drafted, and in last year, the cabinet approved that one, but that was not part of the finance bill. But this time, we had a campaign that this health levy should be imposed in the next financial year budget, and the budget is going to be announced on 12th of June this year. So it's very close to the, in the next week. At this time, it's peak. Next slide, please. At the same time, our minister had very healthy discussion with the media and the civil society groups to implement the Article 19. That is about the compensation liability. He encouraged the civil society and some other persons who are affected through the tobacco products to have a public interest litigation in Pakistan. I think so. One of the civil society organizations, they have contacted some patients from Karachi, and they are willing to have the public interest litigation. We will have two benefits from that. One is to get compensation on the Minnesota model that was about in USA, Minnesota, in which the company agreed to pay about 6 billion as compensation. That model is being adopted in Pakistan. And secondly, there would be some directions from the court to make the current law, tobacco control laws, compatible to the FCTC obligations of Article 9. We can also change our existing legislation through this. Next slide, please. In this corona pandemic, we are working on every sector, like not only the taxation issue. Our minister has sent a strong proposal, the health minister. I'm talking about the health minister. Health minister has sent a strong proposal for tobacco taxation reforms to get about 24 or 25 billion rupees additional. And also, in March, we have worked on the taps, and we have banned point of sale advertisements of tobacco products. Also, we have banned tobacco promotions which were related to the retailer side. At the users level, at the consumer level, these retailers or these promotions were already banned. but at retail level, these were not banned. So we have worked on it and we banned these point of sale advertisements and promotions. And also FBR is very active. They are conducting the raids on illicit trade, and different raids have been conducted in different areas. And more than all, we are also working to implement the track and trace system. In last year, that was about to be implemented. The contracting process was completing, but unfortunately, due to some loopholes in the contracting process, the relevant High Court made it wise the license given to that company. So the court direct for the recruitment of fresh companies, and that will be started again. Hopefully for the next financial year, the track and trace system will be implemented. And we are also looking for different avenues, the avenues from which we can counter the tobacco industry tactics, and we can make them liable for the compensation. Next slide, please. In the conclusion, I can say that, you know, in the COVID-19, tobacco industry tactics are on its peak. They are manipulating the facts. They are misleading the policymakers, and also they are influencing the policymakers for their own beneficial. But tobacco control activists and government of Pakistan is working to counter all their tobacco industry tactics. And we have a very strong coordination mechanism. We have multi-sectoral coordination within the government, or also with the civil society organizations. Our civil society organizations are very active at this time. They are countering every tactics used by the tobacco industry, and government is also very active. And we want to have the public interest litigation in Pakistan. We want to implement the Minnesota model in Pakistan. And we also want that a special project should be launched by the STOP or some other organization which are working on that for the tobacco industry monitoring in Pakistan. Although we are monitoring, tobacco industry interference index has been implemented, but a full-fledged project can be implemented here. With this, I would like to thank all of you. Thank you very much.
Thank you, Mr. Javed, and thank you for presenting Pakistan's good practices, and it should inspire many countries to follow. I wish to announce that we have a change in our presentation sequence due to Dr. Rodiger Kresh urgent matter that he has to attend. He will now be giving the closing remarks before our last speaker, and we do apologize for that. But it's important that we give the floor to Dr. Kresh. He is currently the Director of Health Promotion Department in the World Health Organization. But prior to joining the WHO, he was in charge of German International Corporation, GIZ as we know it, on social protection from its headquarters in Germany and in India. With a solid background in public health, Dr. Kresh has also held various management positions at the WHO Regional Office for Europe in Copenhagen in the fields of health science, health policies, and health promotion. So Dr. Kresh, you have the floor.
Thank you so much for your flexibility, and very warm afternoon to everyone. So let me just say how happy I am that you are convening this seminar, this webinar, because we see that hundreds of thousands of people realize the risk of smoking in a pandemic that affects their respiratory system. COVID-19 has exposed the close link between communicable and non-communicable diseases, with people with pre-existing conditions at greater risk of being affected by the virus. The pandemic has confirmed what many of us have said for a long time. Health is a seismograph for development, and health is a political choice. The swiftness in which temporary sales bans on tobacco has been implemented in some countries demonstrates what is possible if there is political will. Tobacco use is a major risk factor for NCDs, and there is a close link between tobacco and COVID-19. The novel coronavirus attacks the lungs, and evidence shows that smokers in general are more at risk from lung infections like pneumonia, flu, and tuberculosis. Smoking weakens the immune system and is a leading cause of non-communicable diseases such as cardiovascular disease, chronic respiratory diseases, and cancer. Early studies signal that smokers and people with non-communicable diseases who contract COVID-19 may experience more progression and worse outcomes. Even the physical act of smoking can make smokers more vulnerable to COVID-19 because of the risk of increased hand-to-mouth contact and potentially contaminated products. Recognizing this threat, the tobacco uses different tactics of corporate social responsibility activities to present themselves as public health partners in the fight against COVID-19. The tobacco industry is exploiting the pandemic to lobby for relaxation of sales restrictions and to market vaping products. Here are specific examples of the tactics used. First, marketing. The tobacco industry has been actively using COVID-19 references focused on the topic of social distancing, shelter in the place, quarantine messages, personal protective equipment, hand washing, avoiding discussion on the health risks of smokers and vapors in promotions. Second, lobbying. We have documented the industry activity interfering to stay listed as essential or to be listed as essential. Third, misleading research. Tobacco, nicotine, vaping industry funded studies that offer misleading information on tobacco or e-cigarette users lower risk of contracting COVID-19. The Foundation for a Smoke-Free World has called the EOIs from universities and researchers, and it is important for each one of us to sensitize all our collaborating institutions of the tobacco industry's links with such calls for proposals. Then, last not least, CSRs. The companies are actively marketing their philanthropic contributions in the form of direct charitable contributions or in-kind donations. But we, the tobacco-free community, are gaining strength. The World No Tobacco Day this year shed light on so many facets of industry influence. This year's campaign was very successful in exposing their tactics to inform and empower children and youth of the industry tactics targeting younger people. Colleagues and friends, I'm happy and proud that we reached over 2.7 billion people with our campaign this year. This is 1,000 times more than campaigns normally done with WHO. The campaign went viral. We exposed the tobacco industry for what it is, and we helped children and adolescents to better understand how the tobacco industry abuses them. We have now an opportunity to accelerate the implementation of the WHO FCTC. The tobacco industry's relentless marketing and selling of toxic, addictive products have weakened the health of millions of people around the world, and the ensuing cost of treating tobacco-related diseases puts healthcare systems under enormous pressure. With the WHO FCTC, governments have the power to hold them accountable. Country practices show that the tobacco industry can be held liable to pay for harms such as through healthcare costs and polluters' fees. Tobacco-sourced funds can also be used to simultaneously improve people's health during the pandemic and invest in public health systems to prevent the next one. Strengthening implementation of the WHO FCTC is embodied in targets 3A of the UN Sustainable Development Goals, but its successful implementation directly affects a majority of SDGs. It addresses fundamental health and safety issues in COVID-19, as well as leads us closer to our shared goals. Government responses to COVID-19 must be WHO FCTC compliant. Government responses to the COVID-19 may vary, but there are some common policy areas, such as the new normal, and you just raised it, or reopening guidelines on economic recovery plans, where promoting evidence-based tobacco control measures could play a key role. And with that, I thank you.
Thank you very much, Dr. Kresh, and thank you for spending time with us this morning. I now like to return to our next speaker, Mr. Paul Jeremiah Jr. He is also known as JP among his friends and colleagues, who is working at WHO Geneva. He is currently Unit Head, Fiscal Policies for Health Department of the Health Promotion. Prior to joining WHO in 2016, he was the Undersecretary of the Domestic Finance Group of the Department of Finance in the Philippines, where he spearheaded reforming the country's fiscal and tax systems, including the sin tax reform law, which generated $3.9 billion in its first 3 years of implementation. JP, you now have the floor.
Thank you very much, Toy. My topic essentially is on building back better with the WHO FCTC. Next slide, please. Yeah, I'll start with the bottom line, key messages, and I'll explain it further down. With the lockdown easing and parts of the world moving from containment into economic recovery, we need to have certain principles, and these is essentially my key messages. Health is fundamental in any economic recovery plan. Number two, that tobacco industry interests are irreconcilably opposed to a recovery founded upon health and the WHO FCTC. That fiscal policy will be a key driver of any recovery plan. And the fourth message is now is the best time to accelerate tobacco control as a component of a comprehensive package for investing in a healthier population. So let me go through each of these key messages. Next slide, please. As rightly pointed out by Dr. Tedros in his address during the first virtual World Health Assembly meeting on 18 May, he essentially said that health is fundamental to any economic recovery, and essentially highlighted the linkage between people and planetary health, and the need for public health architecture and infrastructure, and economic recovery. Next slide, please. And regardless of any recovery shape, whether it's a Z shape, V shape, Nike swoosh shape, U shape, W recovery shape, or L shape, and as this is essentially we adopted from Brookings Institute analysis of how the shape of the recovery may come out. One thing is clear: health will be a fundamental pillar in any economic recovery. Next slide, please. As discussed and highlighted by many speakers, the tobacco industry, particularly big tobacco, is taking advantage of the pandemic. And there were a lot of examples that were given by the previous speakers. Next slide. But I would like to highlight this from an economics analysis standpoint, particularly on the tobacco industry CSR. We have done some number crunching, and we have discovered that at most 1% of annual smoking related expenditures, and much less 1% of annual smoking related costs are really, if you were to compare the CSR contributions to the annual smoking related health expenditures and the annual economic cost of tobacco use, it really leads me to this conclusion that better to tax, increase tobacco taxes than rely on corporate social responsibility from the tobacco industry, or better to transform the CSR contributions into mandatory payments to compensate healthcare systems for the additional expense governments are incurring for treating COVID-19 cases, which are made more severe as a result of smoking. Next. So the conclusion here is really irreconcilable. If tobacco industry is selling a deadly product that kills 8 million people, how can it be reconciled with a recovery which is founded on health and the WHO FCTC? Which leads me to my third message. Fiscal policy will be the key driver of any recovery plan. If you remember your basic economics on the aggregate demand, GDP, if you look at it, the various components is consumption, investment, government, exports less imports. But with the consumption down because of layoffs and the lockdowns, with investments down because of anticipated business closures, exports down, trade policies are constrained, and there's a lot of uncertainty and low market confidence. There is no other way but for fiscal policy to be the main key driver of any recovery plan. Let me go to the next slide, please. Which leads me to this position. There is no better time to increase tobacco taxes. Increasing tobacco taxes is a win-win-win for revenues, for health, for public health, and for equity. And if you look at the numbers now, the weighted average retail prices and taxation globally, and our best practice really is 75% of total retail price in tobacco should be on taxes. We show that there is really more room for further tax increases. In fact, an analysis by a colleague of mine is that for every 25%, 25 cents increase per pack of cigarettes globally, there will be an increase in fiscal space of 1.14% in low-income countries, 0.89% in low and middle-income countries, and 0.64% in upper and middle-income countries. And if these funds are allocated for health, there will be an increase in low-income countries of 9.63%, in low middle-income countries in LMICs of 8.6%, and 4.2% for upper and middle-income countries. Next slide, please. And in the context of the debt, remember a lot of countries are incurring debts because of this fiscal stimulus package. And adopting the analysis by IPPR, wherein they look at the policy options for keeping debt sustainable post-COVID, you see there that smart tax increases has really one of the least best in terms of reducing bad economic side effects and in mitigating inequality effects. In other words, again, increasing tobacco taxes is a win-win smart tax. And in many cases, it's really a revenue source and really described as the best health policy in the world. Next slide, please. Other elements of an WHO FCTC aligned recovery plan. I mean, this was already mentioned parts of it by many of the speakers, so I don't want to go into detail on this. But suffices to say that it's really important that if you need to have a recovery based on health and a green recovery, you really need to have a recovery plan aligned to the WHO FCTC. Next slide, please. Now really now is the best time to accelerate the implementation of the WHO FCTC as an investment for healthier population. It's a critical component for a healthier population. Next slide, please. So building back better, healthier and greener is really important. Basing on any recovery plan should consider WHO FCTC. They should consider raising tobacco and other health taxes as a way to reduce the consumption of harmful products which are deemed risk factors to non-communicable diseases, and while at the same time raise revenues in the process. The bottom line is, if you incorporate WHO FCTC in any recovery plan, if you raise tobacco and other health taxes as part of a comprehensive economic recovery process, you will certainly contribute to the sustainable development goals. Next slide. In conclusion, certainly we can build back better, healthier and greener with the WHO FCTC accelerated implementation as an essential component of any recovery plan. However, what we must do is to unite against tobacco industry interference. The time is really, there is really a golden opportunity to do this. And the time now is for action and not just to talk about it. Thank you very much.
Thank you very much, JP. And thank you for your recommendation that fiscal policy will be the key driver for any recovery plan. And examples like raising taxes, withdrawing subsidies given the tobacco industry, and promoting alternative livelihood can fuel the recovery plan and provide sufficient budgets for tobacco control. And now I am sorry that we are running a little bit late, but thank you for your patience and flexibility. We now have the last poll. Do economic subsidies and incentives for business affected by the pandemic also apply to the tobacco industry in your country? And now we have the response, which is coming soon. And the response is that 55% says no and 45% say yes. So we're a bit split on this question. We're now almost at the end of our webinar. We are open for the Q&A session. Unfortunately, our live stream session on Facebook will now be terminated. We have a lot of interest in terms of submitting questions to our speakers. Some of them have already been addressed by the presentations. So due to time limitation, we have selected one question, which we wish to ask Dr. Adriana Blanco Marquizo in answering this question. What is the one provision in the WHO FCTC that you would recommend the LMICs to implement at this time? Dr. Adriana? So,
you hear?
Yes, please.
Okay, thank you. Well, I think I need to agree that I'm going to take two, okay? I need to agree that in this moment, taxes is one of the most important thing because of the need of money and of the difficult that is going to be, as it was said by my colleagues here, for the industry to go against it now. But in general and beyond the pandemic situation, I think that there is a couple of measures that are basic and that is, even though they are the ones that have been more advanced, still there is a lot of parties that have not advanced anything on them. And basically I'm talking about smoke-free environments and health warnings, and I'm going to explain why. Because these two articles are entirely in the hands of the Ministry of Health. So it's something that in different countries has passed as a legislation by the parliament, but in other countries has passed as just as decree initiated by the Ministry of Health, but by the executive. So I think that is my combined answer, let's say. In this moment, because of the pandemic, taxes, but don't forget that smoke-free environments and health warnings are in the hands of the Ministry of Health. Thank you, Toy.
Thank you very much, Dr. Adriana. We will send a copy of all the presentation of the webinar to all the participants, and also we will try to answer your questions that have not already been addressed. I would like to once again thank our speakers and our participants for a very informative webinar. You may reach out to us at GTTC or STOP for any technical assistance you may need. We are here to help you. Please join us again for our upcoming webinar on accountability in July. Thank you and stay well and safe.
Thank you, Chair, and thank you all.
Thank you.
Thank you very much, Toy.
Thank you.